Hi everyone, I am Beatrice. In this video, we'll continue with defense mechanism, but this one will be on negative defense mechanism. I've done a video on positive defense mechanism. Be sure to check it out. Now, before the end of this video, I will review some NCLEX-style questions in relation to negative defense mechanism. So stick around, let's begin. Just to recap, defense mechanism has to do with anything somebody using coping with a distressing situation. In the case of anxiety, how somebody is able to adapt or cope. That's what we mean by defense mechanism. This is part of psychiatric review. And now by negative defense mechanism, we are saying those defense mechanisms that when this person demonstrates it, it may not be of good interest to them. So the first one is denial. So as it goes, you are denying a situation. So it means refusing to acknowledge reality. An example would be somebody that has been diagnosed with cancer. It now begin to say, oh, I don't have it. It begin to reject it and say, I don't have it. Or someone that is diagnosed with diabetes mellitus. And then this person says, my sugar has always been normal. It is not me. I don't have diabetes. And begin to eat anyhow, will not be careful in choosing what to eat. That would be an example of denial. The next one is displacement. So as it goes, you are redirecting emotion to a safer outlet. An example would be a woman that is angry with the husband decides to start screaming or shouting or venting that anger on the children. That would be an example of displacement. The next one would be conversion. So conversion has to do with to convert, right? So it means unconscious transformation of psychological distress into physical symptoms. When somebody transforms psychological distress into physical symptoms without any cause. So it's an unconscious action. So an example would be a student that is extremely anxious about an upcoming exam, suddenly develop numbness in the finger and is not able to use the fingers to write. Meanwhile, there's no physical cause, no physical injury. There's no injury to this hand, but yet this person cannot use those hands to write. It says the hand is numb. That would be an example of conversion. The next one will be projection. So projection is like projecting. You are attributing your thoughts to others. Most times, your thoughts is something that you are doing it's not right, it's not good. An example would be a man who is telling lies, decide to accuse the partner of lying instead. That's projection. Something that the person is doing, now decide to blame it on others, tell others that they are the one doing it, meanwhile they are the one actually doing it. So you are projecting your thoughts into the other person. Most times those thoughts that are projected are actually negative. The next one will be rationalization. So rationalization means to justify. When you justify unacceptable behavior with false reasoning. An example would be a student that failed in an exam. Instead of acknowledging the fact that he didn't do well, now decide to blame it on the teacher, saying, oh, it's because of this teacher, he never liked me before, that's why I failed this exam. That would be an example of rationalization. If you are enjoying this video and you have not yet subscribed, please go ahead, hit the subscribe button, also leave your comments. The next one is regression. So as it goes, regress is when you revert. It's when you revert to earlier stages of development. Most times it's due to a reaction to a stressful event, a situation that is not palatable. An example would be an 8-year-old child who is toilet trained, but after surgical intervention now begin to bedwet. That would be an example of regression. Or an older person that has just been told about a diagnosis that is distressing, now begin to lick the tongue or begin to suck the finger or begin to call mommy, daddy, some of those things that has to do with childlike behavior. That's what we mean by regression. The next one is reaction formation. So this one has to do with acting opposite to what you mean. You are saying something, but you actually mean the opposite of what you are saying. An example would be a mother that just had a baby, but is feeling depressed because of the delivery and all the stress, but now decide to suddenly start showing love to that child. That's an example of reaction formation. Another example would be a student who is jealous of the classmate's success, but constantly praises the person and pretend to be their biggest supporter. That would be an example of reaction formation. The next one is introjection. So this one has to do with internalization of others' beliefs, others' values. An example would be somebody that just lost a loved one. Because of that, the love they have for that person now begin to dress, put on their clothes, begin to talk like them, begin to dress like them, begin to speak like them. That is introjection. The next one is isolation of affect. So it means you are isolating affect. You are separating your emotion from a memory that is distressing in order to avoid anxiety. An instance would be someone that has just been sexually assaulted, now begin to tell the story as if they are reading a storybook. The next one is withdrawal. So as you go, withdrawal is a physical or social retreat where you withdraw from more palatable experiences. For instance, somebody have been diagnosed with a condition that is not of a good news at all. And then this person has decided to withdraw from everybody, would not want to see anyone, who doesn't want visitor, doesn't want to talk to any family friend or any member. So that's an example of withdrawal. The last one is dissociation. So this one has to do with disconnecting from reality. Don't confuse it with isolation. For isolation, it's just the affect, the emotion that is being separated. But this one, the person is totally disconnected from reality. An example would be a soldier that witnessed a war where there were lots of killing. But he's not describing it as if he was never there, as if he watched it somewhere in a TV. Totally separate his emotions, separate everything about him from that event. That's an example of dissociation. Now let's look at some NCLEX-style questions on negative defense mechanism. The first question: a patient diagnosed with type 2 diabetes mellitus continue to eat sweet and state, "My sugar is always fine." Which defense mechanism is this? A. Isolation. B. Denial. C. Rationalization. D. Regression. The answer will be denial. The next question: an individual who is jealous of a co-worker says, "They are always trying to compete with me." What defense mechanism is this? A. Sublimation. B. Reaction formation. C. Projection. D. Repression. The answer will be projection. Another question: a hospitalized adult client begins sucking their thumb and asking for their mother after receiving a bad news. Which defense mechanism is this? A. Identification. B. Regression. C. Intellectualization. D. Isolation. The answer will be regression. Let's look at this question. A mother who feels ambivalent about her newborn becomes overly affectionate and attentive. What defense mechanism is this? A. Sublimation. B. Reaction formation. C. Rationalization. D. Conversion. The answer will be reaction formation. Now, the last question. A 27-year-old woman suddenly experiences temporary blindness after witnessing a violent assault, but no physical cause can be found. Which defense mechanism best explains this reaction? A. Introjection. B. Conversion. C. Denial. D. Dissociation. The answer will be conversion. So that wraps us today's topic on negative defense mechanism. If you find this video helpful, please like, share, subscribe, and leave your comment. Thanks for watching.